Why does corona infect vaccinated individuals? In the United States, France, the United Kingdom, Argentina, Brazil, India, and many other countries, many new cases of the Delta and Omicron variants of the corona are emerging. On the other hand, scientists, doctors, and public health watchdogs rely on vaccines to prevent corona that have already been tested worldwide and have been approved to avoid infection. Here we will analyze how successful these vaccines are in controlling the epidemic. With countries such as the United States, France, and the United Kingdom seeing daily increases in the number of new cases of COVID-19, the benefits of the vaccine have once again been debated on social media. While some consumers are encouraging the vaccine, others appear to be condemning the potentially harmful effects of the vaccine. The side effects of vaccines that have been observed so far are very mild, and these effects go away within a few days of being vaccinated. Significant complaints after receiving the vaccine include pain and redness at the injection site, fever, headache, fatigue, muscle aches, chills, and nausea. Experts say severe conditions such as anaphylaxis, thrombosis, pericarditis, and myocarditis, inflammation of the heart, are rare. At the same time, they say that the benefits of vaccination far outweigh the risks, side effects. The vaccine developed against the first wave of COVID-19 included Pfizer, AstraZeneca, and other vaccines. Their goal is to reduce the risk of the disease becoming severe, a risk that the infected person may need to be hospitalized or die in extreme cases. The more serious the code, the greater the vaccine's effectiveness. Therefore, the primary purpose of these vaccines was never to prevent the infection itself but to make the body more resistant to the attack of coronavirus so that the attack of corona is less harmful to the body. The same thing applies to the flu vaccine, which has been available for decades. The flu dose, given every year, does not necessarily prevent the spread of influenza virus infection. Still, it does protect the most vulnerable groups, such as children, pregnant women, and the elderly, from recurrent complications. Looking at the broader scenario, it is clear that this protection against the most severe situation has a direct impact on the entire health system: reduction in the severity of respiratory infections, reduction of congestion in emergency rooms, beds in emergency care wards, increased availability, and more time for the healthcare team to treat patients properly. According to the Commonwealth Fund, vaccine against the coronavirus has helped prevent more than 1 million deaths and more than 10 million hospitalizations in the United States alone by November 2021. The European Centre for Disease Control and Prevention, ECDC, and the World Health Organization, WHO, estimate that 470,000 people over 60 in 33 European countries have been vaccinated against the disease since its inception. People's lives have been saved. It is undeniable that many people who have been vaccinated recently have reported reinfection, and 3 factors can explain this. The first reason is simple. People traditionally celebrate during the New Year and Christmas, which increases the risk of transmitting the coronavirus. Secondly, almost a year after the vaccine became available in some parts of the world, experts have discovered that immunity against COVID-19 does not last forever after vaccination. We've noticed that the level of protection decreases over time, says Khabar. This reduction varies depending on the type of vaccine and the age of each individual. This highlights the need for a third dose of the vaccine, booster shot, first for the elderly and those with low immunity and then for the entire adult population. The third reason is related to the advent of Omicron variants, which can move faster and against which the immunity obtained in the form of a vaccine or a previous code appears to be less effective. Given this, reinfection in vaccinated people should be treated as normal, and we have to learn to cope with this situation. Fortunately, despite the recent increase in COVID cases, hospital admissions and mortality rates have dropped, especially among those who have already been vaccinated. The vaccine, as expected, provides protection against a very serious situation. Charts from the New York City healthcare system clearly show the practical effectiveness of the vaccine, showing the high incidence of COVID infections, hospital admissions, and deaths among those who have been vaccinated and those who have not. In early December, cases in the city showed a sharp rise in hospital admissions and mortality rates for non-vaccinated people and a relatively stable rate among vaccinated individuals.